Hi, I'm Marc Aversa with Sound Family Medicine. I'm one of the physicians here, and we're going to talk today a little bit about the importance of vaccinations. Vaccines, as most people know, are quite safe, and they're used both for children and for adults to help prevent illnesses that otherwise would be very hard to treat. So, for example, influenza, while we have a medication that can treat it, it's very hard to get people started on that medication at the right time before things get bad. And there's other illnesses caused by either viruses like influenza or bacteria like tetanus and botulism that there really isn't an easy way to treat those once people get sick with it. And so that's where we use vaccines. Vaccines can help us avoid dealing with an illness like that would be otherwise a real challenge. Another important reason to vaccinate is to help make sure that we protect others around us that are potentially at risk. We talk about herd immunity, which is that if you get enough people vaccinated, even somebody who can't respond to a vaccine or who has an illness that might put them at great risk can be somewhat protected by those around them not being susceptible to the illness. When we're vaccinating children, parents often have a little challenge keeping track of where they're at in their vaccine schedule. It can be very complicated. Fortunately, the state now makes it very simple for us to track vaccines. We all, at our organization, report every vaccine that we give to a state website, and we can show you how to both look at that to figure out where your child is in their vaccines, and also to be able to print that off yourself if you ever need it for a child for school, for example. For adults, vaccines continue to be important. We have several illnesses, including tetanus and pneumonia and influenza, that require vaccines on a regular schedule. And in addition, one of the newer vaccines is the shingles vaccine, which we call Shingrix. And that's, again, very important for adults to get these vaccines to prevent illnesses that we otherwise wouldn't be readily able to treat. People are very interested, of course, in a vaccine for the novel coronavirus, COVID-19. And right now, of course, we don't have a vaccine available. But as we look at the tremendous anxiety that this illness is bringing to our communities, I think that there's a lot of parallel to things that used to be a real problem. But now with vaccines, we don't really think much about. Polio, for example, used to strike communities and cause tremendous fear, especially because children were susceptible to it typically. And if a child got polio, they could have permanent nerve damage that we still see in some of our older patients today. But the vaccine has made that something that we don't really think about. We're really hopeful for a time with COVID that we'll have a vaccine that can hopefully help spare most of our community from this type of illness and get to a point where we're no longer afraid. I hope that this has been a helpful presentation. We are, of course, at Sound Family Medicine, all available here to help you with your healthcare needs, including vaccines and other things. Our office is able to see you in office. We're able to do video visits now. We're seeing patients in the car. And we can answer your questions on the phone as well. So you take care.